Hello, my name is Julia Lloyd-Parks and I am a Senior Partner at Transcript Partners. I'm here to talk to you about the Sponsor Support Organisation, a new type of organisation that can help pharmaceutical companies in the development of their products. Outsourcing in the pharmaceutical industry has developed over time. The first stages of outsourcing were transactional outsourcing, which has the objective of obtaining additional capacity and tends to be focused around task-based activities. The main driver in this type of outsourcing is the cost of the services. However, it does not give the sponsor much opportunity to influence the vendor, as each activity is relatively small in the context of the vendor's operations. This graphic shows the stages in the development of outsourcing and the shift of resource between the sponsor and the vendor. The development of relationships from preferred partnerships through to strategic alliances brings with it more focus on quality and mutual benefit. These types of relationship require time and resource within the sponsor company to ensure that the selected vendor has the best fit to its organisation. As these types of relationship develop, an element of risk sharing becomes a feature. This is the historical perspective for industry as a whole, but in fact each pharma company has followed its own path through this development, and each progresses as far as fits with its own philosophy or objectives. However, the increasing number of small companies, startups, biotechs and virtual companies do not have the resource to follow this path and are likely to remain in the transactional stage. Outsourcing requires in-house resource to set up, and even when the contract is signed, there is still the requirement to manage the vendor. Most companies outsource activities that are repetitive and require a large number of people. This might include clinical operations, for example trial monitoring, data management, non-clinical drug safety, and distribution and sales. However, they will retain the core competencies in-house because they realise that the outsourcing relationships need to be managed. However, small companies may not have the resource to enter into such relationships and manage them successfully. Here we illustrate just some of the activities required to manage a vendor. The three major stages of the project are initiation, and time spent here will pay dividends for the next stages. During the active phase, oversight is essential as the project moves forward. And the end stage is equally as important because satisfactory completion is essential to satisfy regulatory inspection. There have been cases now in the public domain that demonstrate the potential risks when there are poor systems in place for oversight. In the case illustrated here, the FDA issued warnings to both the sponsor and the CRO, resulting in delayed registration at a cost of millions. In the case of Sanofi Aventis and PPD, in the development of Keytech, the FDA made absolutely clear that the sponsor retains full responsibility for monitoring of the sites. It is Transcript's experience that vendor oversight is a key area in the conduct of GCP regulatory inspections. It is clear, therefore, that effective vendor oversight is critical in safeguarding the company's investment in its product and to meet the requirements of good clinical practice. This environment, however, creates a bottleneck for the small sponsor who has limited resource and funding. Small companies may not have all of the internal functions that a big pharmaceutical company would take for granted. For example, expertise in the whole drug development process, expertise in translational medicine, or perhaps regional input and regional representation. So therefore, what are the options for the small sponsor to address this resource bottleneck? They could use a full-service CRO alone. However, using one major company could be risky for a small company. They could set up their own development department. However, this brings with it a cost in the overheads and also induces a lack of flexibility of the type of resource available. They could work with multiple freelancers or one-man bands. However, this brings along coordination difficulties and could lead to a very disjointed approach, and also the risk of losing knowledge from the organisation. The final alternative would be to bring in a sponsor support organisation. The sponsor support organisation is a new type of organisation that can work as part of the sponsor team. It can provide technical support to the sponsor, and this can complement the expertise that already exists there. It can provide regional input and expertise as necessary, and also act at the interface between CROs and vendors. The sponsor support organisation can provide access to the full range of expertise required for drug development. This expertise can be accessed flexibly, and over the long time helps to develop and maintain programme knowledge and project history. The sponsor support organisation can provide a flexible fit to a drug development company. It can provide sponsor type activities as shown in the top part of this slide. And as the project progresses and outsourcing demands grow, the sponsor support organisation can act at the interface, representing the sponsor to the CROs and other vendors as shown at the bottom of the slide. The sponsor support organisation can play a key role in reducing the risk of the development process by providing development resources to manage and oversee the volume activities required to bring a clinical trial programme to completion. This can help prevent GCP inspection failures. The organisation can also provide the sponsor with continuity from the clinical trial activities right through to the MAA submission. In addition, they could apply specific expertise and knowledge to the development process. To summarise, the sponsor support organisation becomes integral to the sponsor team, and the role of this combined team is to drive decision making throughout the development process, from proof of concept right through to launch. The team can also drive communication to all of the subcontractors and vendors, and maintain within the team the continuity of knowledge from the trial to the registration. The team should also work to ensure an open management structure that allows knowledge sharing throughout the team. I hope that you have found this short presentation interesting. If you would like to discuss the concept of the sponsor support organisation or would like to receive a copy of the slides, then please contact me. Thank you.